back. It's a condition that impacts millions of people across the United States. Arthritis not only causes joint discomfort, but it can also cause joint damage. Fortunately, there are treatment options available, and joining us now is Manthe. She is an orthopedic surgeon with Jacksonville Orthopedic Institute. Welcome to the show. Thank you for being here. We appreciate time away from your busy schedule. I know you're back to see patients right after this.
I am.
So we'll take advantage of you while we have you. Starting off with, what exactly is arthritis for those who might not know? It's a common term. You hear quite a bit, but what is it?
Yeah, so arthritis is basically just the degeneration of the joints. So what used to be a smooth-on-smooth cartilage joint over time can become a rough-on-rough, just bone-on-bone joint, and that causes inflammation, which then causes pain. The variety of causes, that can be even just a big injury that causes the arthritis. Sometimes there's autoimmune conditions like rheumatoid arthritis, and sometimes we just don't know exactly why it happens, but we know that there's got to be some genetic component as to why some patients develop arthritis and others don't.
So as some people might start experiencing symptoms of arthritis, that pain in the joints, what are some of the early treatment options to try to nip it in the bud out in the beginning?
Yeah, so there's a lot of non-operative treatment measures that we can take. Sometimes it's just simple activity modifications. Early on, there might be one activity that causes pain. It might be one maneuver in the gym or one activity, and we say to modify those if you can.
Don't do that if it hurts.
Don't do that one thing.
Okay.
Other early treatment modalities are going to be anti-inflammatory medications, so your Aleve, Advil, ibuprofen. And those are the kind of the first line treatment, because as arthritis is an inflammatory condition, the anti-inflammatory medications work best.
Right.
As it progresses, you can use canes or walkers to offload the joint. We can also give injections which provide temporary relief, but it is temporary, and I always tell my patients that this is a temporary relief. It can last, a few weeks to a few months, and that's the goal from the injections. But once those fail, then we start to talk about surgical options.
Right, and let's talk about that, because there are a lot of people who will take the acetaminophen, the ibuprofen, but to take something like that long term can cause obviously damage to the liver, what have you. So you don't want to do that for a prolonged period of time. So then what would be the next step in treating it?
So the next step, once my patients kind of fail the non-operative treatment measures, then we start the discussion on, is surgery right for you? Is this affecting your quality of life? Are you having daily pain? And if the answer is yes to that, then again, we talk about surgery, and it still isn't an elective procedure, so my patients they're going to be the ones that decide when is the right time, is this the right time. I'm just there to help educate the patient on kind of what to expect and help facilitate that decision, yes, it's time for surgery.
And at what point would you need something like a joint replacement, and would that then help with the curing, if you will, I use that word loosely, curing the arthritis?
Yeah, so what I tell my patients is everyone has a different pain threshold. But once you fail, again, once the medications aren't working, and if you're having daily pain, and if it's limiting your quality of life, again, I want all my patients to be as active as possible, even throughout retirement and beyond. I want them to be, enjoying life.
Sure.
If that's not happening, joint replacement actually is a very good solution to get you back on your feet.
And how will that then limit the pain scale? Then if you get the joint replacement surgery, are you going to be pain-free? I mean, are you going to be back to life as usual? What do you typically see with your patients?
Yeah, I mean, typically with my patients, we have a great reduction in pain relief.
Yeah.
We should, as orthopedic surgeons, we should never promise pain-free.
Sure.
Because a lot of our pain, it could be from back-related or things like that. But the goal for my patients is to have a significant reduction in pain. And by having that, your quality of life improves. Usually as a result of decreasing the pain, you're able to get back to your activities, whether that's walking for exercise, doubles tennis, back to the golf course. That's my goal for my patients, is to have them get back to a healthy lifestyle.
And how many of those patients wish they would have seen somebody like you sooner? They put up with this pain, they limit their activities, they don't do the things that they love. At what point in time would you say to them, hey, come see me, you don't have to live like this?
Yeah, that's the thing. A lot of patients, after they're all healed up after surgery, they do say, man, I wish I would have done this years ago.
I wish I would have, could have, should have, if I had only known, kind of thing.
Right. But normally I tell patients it's time to see the orthopedic surgeon if it's new pain that's not responding well to anti-inflammatory medications or just kind of laying off of it, or if your pain is worsening and you're starting to notice that, hey, I'm not able to do my activities anymore. Once you reach that point, it's time to at least come and talk with us.
Okay, we've run out of time, but I just want to address this so I can send this clip home to my mother. Cracking your knuckles, yes or no, leads to arthritis?
No, it's not gonna
Okay,
lead to
there you go. I
arthritis.
wanted to solve that once and for all. I think she does that, though, because she hates it when I do it at the dinner table. Anyways, good to see you, Rachel. We appreciate you.
well.
All right, and we'd like to thank the Jacksonville Orthopedic Institute for sponsoring this segment. For more information or to find an office near you, you can visit joi.net. You can also call 904-JOI-2000. All the numbers and information are right there on your screen.